Thank you for taking the time to attend today's webinar. The subject is the client experience, what to expect from your dedicated client manager. My name is Natalie Sade and I'm a senior client manager at LexTalks. I've been here 10 years and I'm joined this morning by my colleague Claire Hutchings, and she's a fellow client manager and she's been with us 7.5 years. So a bit of housekeeping just before we start. All attendees have been set to mute. This is to reduce the background noise and to ensure you can all hear me. This is a live broadcast, so unfortunately we won't be able to take questions during the webinar, but if you do have any queries afterwards, please email us via experts@lextalks.co.uk, and if you just put in the subject line question from webinar, and myself and Claire will make sure that obviously those get answered for you today. Today's webinar will last approximately 20 to 30 minutes. We'll be recording it and we will share a link post-event. So if there's any of your colleagues who weren't able to join us, who you think would be interested in the seminar, please feel free to share the link with them. Okay, so housekeeping over, let's begin. So the agenda today is we're going to look at on the introduction start, we're going to look at the guide to the instruction process and what actually is a client manager, then take you through obviously the client experience, who your dedicated client manager is, why we have them, our quotation referral forms, and then lastly, why do we have client managers and what is it, why is it important for our relationship with you as clients? Okay, so I'm going to pass you over to Claire to take you through the first slide.
Good morning, everyone, and thank you for joining us today. I'm going to take you through the guide to the instruction process on how to instruct LexTalks to arrange your drug, alcohol, DNA and SCRAM testing. It really does only take 5 minutes to phone LexTalks to instruct us, and client managers are always available to discuss your requirements and answer any questions you may have regarding the analysis process. You can also access our new client app, complete our online or referral form to instruct LexTalks. You will then, based on your location in the country, be contacted by a relevant client manager. Your dedicated client manager will provide you with an official quotation via email, or quotations can also be provided over the phone if urgently needed for court hearings. We will then await confirmation of the official quotation sent to you. If your client is paying privately for the analysis, we would ask for confirmation of funds prior to the sample collection being arranged. Sample collection can then be booked. We will then forward an email confirming the date and time of the collection. At LexTalks, we provide a dedicated client manager, unlike other testing laboratories. This enables us to build a relationship over time that you can rely on, and this is the LexTalks difference. I'm going to pass you through to Natalie now. She'll discuss obviously what is a client manager.
Okay, so following on from that, as Claire was saying, there is a dedicated client manager for each part of the country. And we've actually got 14 client managers at the moment who look after specific geographic areas of the country. So your client manager, they are a dedicated single point of contact who can assist you from start to finish for your case. And the purpose of the client manager is really somebody who can work with you week in, week out, and get to know how you work, how your style is, and try and, take the burden of organising drug and alcohol testing away from yourselves, and we do everything for you. That is, in a nutshell, what a client manager is. We're there to answer any questions regarding the process. We'll take the instructions over the phone for you, or you can send us the court order or email us what you want done. We will provide information on pricing. So if it's not at the formal stage and you're just sort of deciding possibly about what you're going to do, we can give you all the options, whether you want overview analysis, month by month, different pricing for 2, 3, 5, 9 drugs. and all the different options. If you actually complete one of our referral forms, when it comes into us, we will check it and make sure all the information is correct and everything's there. And if your client has been tested previously, then we will check the last testing to see when it was and advise on timeframes about when the new test can take place, because we do advise that you don't overlap the previous time frame, especially if the donor tested positive, because obviously the next test needs to be, as much as possible, a clear new test for them. And also, if you test the same time frame as previously, it's a bit of a waste of money if you've already paid for those months to be tested. And of course, we will go through the whole booking of the appointment process. So we will either provide dates and times to yourself, so you can liaise with your client, or if you want us to, we will speak to the donor direct and arrange the appointment with them. So that's pretty much in a nutshell what a client manager's role is. We're there to make your lives easier and work with you, on a daily basis to assist you in all part of the process. Claire's going to take you through the services that we actually offer.
Okay, so the services we offer: hair and drug alcohol testing, testing for illegal drug, psychoactive substances, spice and substances of abuse. Our alcohol test details 2 types of alcohol markers in the assessment of chronic excessive alcohol consumption. Blood alcohol testing is to help in the assessment of short-term alcohol use. SCRAM, continuous alcohol testing. The SCRAM bracelet allows for 24/7 alcohol testing through scientifically proven technology. Our DNA testing is MOJ legally defensible DNA paternity and relationship testing, such as maternity, siblingship, grandparentage, and avuncular analysis. Series of tests over specific time frames from pre-proceedings to in proceedings. Consistency in analysis is often required, and we can arrange follow-on testing, ensuring specific time frames are covered. Our expert reports provide details of sample analysis, the results of interpretation of those results, and is suitable for the use as evidence in court. Sample collections can be arranged within 48 hours of request and can take place at solicitor, local authority, or donor home, as long as a safe environment. Our CPD seminars provide delegates with an understanding of drug and alcohol testing, and seminars can be arranged online. Should you need more information about this, obviously you can contact your client manager and we can arrange this with you. Okay, over to Natalie now with the client experience.
Okay, so when you have a case, your dedicated, I can't even put my teeth in, your dedicated client manager will take your instructions from you, either over the phone or obviously we'll receive an email with your referral form. We'll then offer advice on the type of analysis available and confirm costs for you. Our client support team will raise the formal quotation, and that will be emailed to you. And if it's split parties, quotes will go out to all the parties sharing costs. There is no charge for split invoicing. And then we will check the file date or court hearing and advise when samples need to arrive in our lab to make sure that obviously you can file your results on time. As I said earlier, we will book the appointment either direct with the donor, or we will offer you dates and times over a number of days, and you would come back to us and let us know when your client is available. The key 2 things we need for the appointment is we need, if it's happening at the donor's home, we need the donor's mobile number for the collector, because they do actually give them a call on the day just to check that everything's okay in regards to health-wise as in COVID. I'm afraid, obviously, COVID is still on the rise, and we are still, checking that there is no COVID in the home before the collector goes there. So they would need to contact them on the day just to make sure that everything is okay. And they'll normally call them en route just to sort of make sure that, I suppose, they're still there and the appointment is going to go ahead, because sometimes we do book them a few weeks in advance. Sadly, not all appointments go to plan, and we do have, I'm afraid, every week a number of donors who fail to attend, or we do have to cancel due to illness, etc. So part of the client manager's role is to rebook the appointments and chase up, obviously, any cancellations and try and get those rebooked for you, as we know, obviously, this needs to try and happen as soon as possible. And then once the actual sample has been taken, you will get a confirmation email to let you know that the sample has arrived in the lab. While the sample is in analysis, if you do have any questions, then obviously contact your client manager. If you want to check on when the results are due, of course, contact us and we will speak to the lab and get an update for you. So that is pretty much the process from start to finish. And now Claire is going to take you through the drug and alcohol quotation form.
Okay, so requests for quotation forms, as we touched on earlier, it is very easy to instruct us, and our request forms for the quotations can be found on our website, and you can also download, and these can be edited or entirely completed online for easy option use. Okay, so the referral form for drug and alcohol testing. Okay. So we have, in section 1, we require you to put the donor's name, obviously date of birth, and sex of birth. This enables us to ensure that we have correct spellings of donor names, which will then tie up with the chain of custody, and also then in our expert reports, just to show transparency throughout the testing, that all details are correct. The second section is for the actual drug testing. Okay, we would ask you to select scalp or body hair. Scalp hair is the preferred method of testing. However, if the donor has insufficient scalp hair, we can analyse body hair. Body hair is tested as a whole section, and it's not time specific. So whereas scalp hair, you can request for the analysis to be segmented or cover a time period of, say, 3 months to cover, say, March to May or June. With body hair, as it's tested as a whole section, it is that whole time period. Okay, so with the drugs also, there is an option there to select the top 9 most common drugs. Okay, we can offer you testing for 18 drugs, and then additional drugs such as steroids, psychoactive substances, spice, and anti-epileptics. But the most common 9 are highlighted there with the orange boxes, and if you just to tick for that, or you can actually, if you just want to choose a specific drug, then that's fine also. If you just want 1 or 2 drugs tested, we can do that for you. Just to recap back, sorry, I missed just earlier, with the scalp analysis, the analysis of testings is month by month, bi-monthly, or overview options, and we do require you to actually add the number of months you would like us to test for. Okay. Section 3 is the alcohol testing. This section is split into both hair testing and blood testing. Okay, you can either have scalp hair or body hair. With alcohol testing for body hair, we can only test chest hair, forearm hair, or leg hair. And we do say if alcohol is a major concern, we do advise that you have the blood tests along with the hair testing to provide evidence of any chronic excessive alcohol consumption. Okay. In section 4 is the instructing party details. Okay. We do require this information, how and how the instruction is being funded. Like I did say earlier, if it's privately funded, funds are needed in place before sample collection to be booked. Okay. Sorry, just move the screen. Okay. In section 5, split invoicing, it's also important that this is included, because what we can do, we can send out quotations to all split parties free of charge, and then this makes the invoicing process easier at the end of testing then, and for when obviously everybody's going through with legal aid agency. Okay, expert report. In section 6, if an expert report is required, you can tick there and put whether or not it's for family court, civil court, or criminal court. If you do not choose to have an expert report and you only choose to have a certificate of analysis, the actual testing information is provided, along with obviously the levels of use. However, there is not an interpretation included. So if an interpretation is needed, that is when we would advise that you actually do request the expert report, which can obviously be used in court. Okay. Results details. In here, we do need it. We will only send the results out to the instructing party solicitor unless additional recipients are entered here. If there's no additional recipients entered, we will not send out the results to any other party or any individual. We will only send the results to the instructing party solicitor or local authority. Okay, in section 8. Okay, this is with regards to the collection process. Okay, again, if you just tick, if you do want a LexTox sample collector to either go to solicitor, local authority, or donor's home, we just ask for the details to be entered in there. You can put options of preferred collection dates in there, and you can also advise of availability as well at this stage if needed. Okay, and I think that is pretty much how you would instruct LexTox on the referral form. But like I say, if you were to ring in and speak with your client manager, they are happy to fill this form in over the phone for you and take all details and answer any questions that you may have also.
Okay, so I'm going to take us through the DNA request form. There isn't any, well, there's only a couple of differences from the drug and alcohol. So I'm just going to highlight the main differences, and everything else is pretty much the same. So in section 1, we need to know obviously what type of test you want. Most popular is obviously paternity, but there is another box, motherless paternity. Now this is really important. If mum is not taking part in the paternity test and we're only taking samples from the alleged father and the child, you must tick motherless paternity, not paternity. The reason being is we will send instructions obviously through to the lab, and if we tell them it's a paternity test, they will be expecting 3 samples. So if they only receive a sample from dad and child, they will not start analysis because they still think they're waiting for mum's sample. So, really important, if mum is not taking part, then tick motherless rather than paternity. Okay. The other tests that we do, obviously, are maternity. And if alleged father's not willing to take part and there's more than one child, then we can obviously do a sibling test. And there's also the grandparentage test and the avuncular, where we can test sort of aunts and uncles. So that's section 1. And then in section 2, we need their full name and date of birth of everybody who's taking part. Really important that we get dates of birth for the parents, because sometimes we do have mums who are under 16, and if they're under 16, obviously there are issues with with who can obviously sign, because they obviously can't sign for themselves. So it's really important that we have dates of birth for everybody. And the really critical thing in section 2 is 2.8, which is who has PR for the child. So if the child lives with mum and the sample's been taken at mum's home, then mum can sign for the child. If a father has PR as well, we would need to, and he is being nominated to sign, we would need to see a certified copy of the birth certificate before he could sign. If the child is in foster care and is under an interim care order, then there is a form that we would get the social worker to complete for us. We would take care of that and send it direct to the social worker, and they would then nominate somebody to sign for the child on the day, and it's normally a foster carer. Now, when the collector goes out to take the child's sample, we will have told them who's going to sign for that child. So specifically on those collection details, it will either have the mother's name or the foster parent's name or a social worker's name. When they get to that appointment, if that person isn't there, then we wouldn't be able to proceed. So it's really important that all of this is sorted out in advance, because only the person named on the ICO form can actually sign for that child. So if there is any changes, we would need to know in advance, because otherwise we're going to have to obviously start all over again and do fresh paperwork. So those are the two critical things that I wanted to point out on the DNA form. The rest of the instruction form is exactly like drug and alcohol, instructing party details of the solicitor, and obviously all split parties. So exactly as Claire went over previously. So that's the DNA form. And then the other one that I wanted to quickly just take you through and point out some, specifics on is the SCRAM form. So on the SCRAM form, on section 1, we would obviously need the donor's details, the participants' details. But the key thing here is if they work, we need to know what sort of environment they work in and their working hours. So for example, if somebody worked in a bar and they were exposed to alcohol, we would need to know that so that the experts were aware. And we would also need to know their work pattern, their shift patterns, because if they work, if they don't work, the normal, I suppose, 9 to 5, but they work shift patterns, we would need to be aware of that so that our SCRAM team can tell the base and the unit to download the data at certain times when we know the donor's going to be at home, because there's no point in us setting up the download times when they're not going to be there, because obviously we're not going to capture the data. So that's quite important. Section 2 is obviously the testing period options. Most popular seem to be 30, 60 or 90 days. The time frame can be extended, but obviously we do need you to let us know if we are going to extend. And if it goes over 90 days, we do have to change the battery on the actual bracelet. So it's really important that we know that, so we can get one of our technicians out to change the battery. The other major difference with this form is section 6, the reporting frequency. You will get a monthly report included in the price, but if you wanted weekly or fortnightly reports, there is an additional charge for each extra report. So you would need to obviously advise if you want those, and we could let you know the cost for that. And it would be obviously on the quotation. And then in section 7, where is the fitting to take place? Now, I would say 99% are now at a donor's home. It's very rare that we would do it at a solicitor's office. Historically, we've only really done it where there's been a major problem with the donor having no internet or no Wi-Fi signal whatsoever. They live in some sort of black hole where there's no signal, and the only way we could do it was at the solicitor's office. But as I said, most of them are pretty straightforward, and we can do it in the donor's home. The key thing we need to know is whether they do have the internet. There are two types of basin units that we can use, one that would plug into the internet, and there's also a wireless basin unit that works off a mobile phone signal that they can use if they don't have the internet. So our SCRAM team need to know what they have in the home so that they know which type of equipment that we obviously are going to use, and we can check our stock to see what we have. And we'll also need to know if they have two spare plug sockets if we're going for the Wi-Fi option, so that obviously we can plug in the equipment. The last thing, which isn't on this form, but when you get sent the quotation, you will be sent what we call a health and safety form. And this is a number of questions that you would need to go through with your client on about whether there are any physical aspects as to why they couldn't wear the bracelets. So it's a check that there's nothing that would preclude them from wearing it. We have had people wear the bracelet who are pregnant, but this has been done under GP advice first. So we would advise that the donor goes to see the GP and checks with them that they're happy for them to wear it. And if they agree, then obviously we can proceed. But the health and safety form would need to be signed and returned along with the acceptance of the quote before we can obviously look at the fitting. The fitting of the SCRAM bracelet, with obviously drug and alcohol, we can normally do a collection very quickly, next day, 48 hours. It does take a bit longer with SCRAM because each piece of kit is worth about £2,000. So collectors don't have a stock of them in their home. They are kept at head office, and they have to be obviously or the computer side of it, they have to be assigned to the donor, etc., and sent out. So we do need a bit more time to obviously organise it. So just to manage expectations, it does take a little bit longer to organise the SCRAM, but we can normally do it within a week. Okay, it's just that we wouldn't be able to do next day as we would with drug and alcohol. And that's pretty much the SCRAM side of thing. The reports, so after the first 30 days of the person wearing the bracelet, the data then is all downloaded and it's issued within 7 working days. Our experts have to go through literally all the readings for every single day, and then they will compile the report and get that sent out to you. If you do have any urgent file dates for the SCRAM reports, please make us aware, and obviously we can let our experts know. That's the SCRAM side of things. Over to you, Claire.
Thank you, Natalie. Okay, I'm just going to recap on why we do have client managers here at LexTalks. Okay, it's because clients can have that single point of contact with the person and the same person who knows you and how you'd like to work. Okay. We only look after clients in our geographical area, and there is 14 client managers around the UK, and areas are split geographically. So we've got all our own clientele to look after. Okay, we build relationships over time, and it is nice to see our clients return back to us, and the relationships we do have with our clients are very friendly, but also very professional. Okay, we are client managers, someone who understands your needs. We understand how busy you can be with your daily workloads and the cases that you are actually dealing and working with. And we do understand that, the help is out there, and we're here to help you with these cases. Okay, we can make the process really easy for you. And like I say, on a daily basis, you can contact us, even if you're not referring and you have questions and you just, you're unsure about something, please give us a call, have a chat with us. We always like to find out as well what's going on within your fields, to find out, what's going on in the courts and what's going on with the local authorities with the testing. So even if it is just a quick chat, to a friendly chat to update on things. And it's also peace of mind for you that you can leave your cases with us in safe hands, and we will, deal with the cases from start to finish.
Okay, so once you've actually had your results, and they've been issued to you, you can still contact us regarding questions that you have. We can answer any questions regarding the results should they need further clarification. We do ask that any questions are submitted and agreed by the instructing party. So if the other parties want to raise questions, they do obviously need to put them through via the instructing party. And, we have to obviously follow protocol. Donors who would seek to ask questions regarding their results are advised to contact the instructing party, as we cannot go to the donor direct. From there, our team will ensure that any response is prepared and issued to the instructing party only, and then we would ask the instructing party to share that with the donor. This is to ensure that we're providing the correct information to the correct party, and it also ensures that any information we provide is handled within the context of legal proceedings and is issued to court for complete transparency. If you do have any questions on results, please contact us via email at experts@lextox.co.uk, or you can send it to the client manager. We will forward it on to our business services team, and they will be in touch within 24 hours to provide further guidance and advice, and advise on any charges, etc. Normally, with questions, if you have had an expert report, I believe a number of questions are free of charge, but if there are a lot of questions and it is quite complex, there may be an additional charge. But as I said, business services would advise you of that in advance and ask you if you are happy to proceed. Okay, so in conclusion, we provide a dedicated client manager, and like other testing laboratories, we don't want it to be like a call center. We want you to be able, to speak to the same person who will, deal with everything for you and not be transferred 5 times in one day. This enables us to build a relationship over time with you, and, we understand obviously your needs. Your dedicated client manager will take your instruction, will answer any of your questions you may have, provide you with official quotations, and book your appointments for you. We are your single point of contact who can assist you from start to finish for your case. Obviously, when our colleagues are on holiday or at lunch, we will, be able to assist other areas, as we all do the same role. But, 99% of the time you will deal with your client manager only. This webinar is part of our bite-sized series, covering our testing options, information on our sample collection process, our experts reports, quality procedures, and obviously this was the last one about client managers. And you can find all of these webinar recordings on our YouTube channel. So I just wanted to say thank you for joining us today. This concludes today's event. And I hope you found it useful and informative, and we look forward obviously to any feedback that you have. And as you can see on screen, those are all obviously the social media links, and the slides will be obviously, the link will be put out to you for the slides if you need them. So thanks for joining us today, and thank you, Claire, for assisting me on this.
Thank
you all have a great day.
Thank you, everybody, for joining.
And try and keep cool.